andropausespecialist.com, Section 2, Testosterone Therapy. Low testosterone and sexual health. Low sex drive in men. Role of androgens on men's sex drive. There are different ways to improve low sex drive. A male sexual dysfunction medical professional can tell you what is causing your low sex drive and recommend treatment. Androgens play an important role in stimulating and maintaining male sexual function. Testosterone is necessary for normal libido, ejaculation, and spontaneous erections. You might experience low sex drive if your androgens aren't being produced regularly. If you have low testosterone levels, a common cause of andropause, this means you're getting less androgens, which are necessary to stimulate your sex drive and produce erections. Other factors contributing to low sex drive in men. Physical and psychological factors also affect sex drive and hormonal imbalance. Some of these are lifestyle, smoking, drinking, drugs, lack of exercise; psychological, stress, anxiety, depression; disease, diabetes, blood pressure, cholesterol, obesity; use of certain medications, antidepressants, antihypertensives, antiepileptics. A male sexual dysfunction specialist can identify the cause of the problem and recommend appropriate treatments. Risks and side effects of testosterone therapy. It's important to know that if you've had prostate cancer or breast cancer, you are absolutely not a candidate for testosterone therapy. Testosterone can make either of these cancers grow faster. There are other negative factors to consider. Fluid retention. It is possible, especially within the first few months of treatment, for a man to retain fluid. Studies of healthy older men have shown problems with fluid retention leading to ankle or leg swelling, worsening of high blood pressure, or congestive heart failure. It is unclear whether there would be an effect in men who are ill, for example, those with congestive heart failure. Liver toxicity. There have been no reports of liver toxicity from transdermal testosterone replacement. However, oral testosterone replacement can cause significant liver problems. Interestingly, every manufacturer, even those producing transdermal testosterone, mentions the possibility of liver problems. This should be taken into account. Problems with fertility. Spermatogenesis, the production of sperm, in all men is dependent on production of testosterone by the testes. If testosterone is given from outside, the testes will stop producing their own testosterone. This will shut down sperm production either significantly or completely in nearly all men. This may be a temporary or permanent testosterone side effect. Younger men who still plan to have a family must take this into account when considering the effects of testosterone replacement therapy. Some men have banked their sperm. For more information on this subject, visit www.spermbankdirectory.com. Other men have delayed testosterone replacement until they have finished having children. It is important that any man considering a family be very careful in starting testosterone treatment of any kind. Sleep apnea. Sleep apnea is a condition in which individuals stop breathing for periods of time while sleeping. This can have significant medical effects. There have been reports that increased testosterone levels exacerbate pre-existing sleep apnea. However, a 36-month trial of testosterone therapy in older men reported no effect of treatment on apneic or hypoapneic episodes. Tender breasts or enlargement of breasts. This may occur in some older men who are on testosterone therapy. This may be due to the conversion of testosterone to estrogen. Breast tissue in both men and women is very estrogen sensitive. Sometimes this side effect can be overcome by decreasing the testosterone dose. Increased red blood cell concentration, polycythemia. One of the most important side effects of testosterone replacement therapy can be an increase in the red blood cell mass and hemoglobin levels. This is particularly true of older men. Increased blood cell mass may increase thromboembolic events, heart attacks, strokes, or peripheral clotting in the veins. Men who develop increased hematocrit can decrease testosterone replacement or can donate blood to decrease their blood cell mass. Prostate growth. The growth of the prostate can have a negative effect on men in two ways. First, the prostate may increase in size, benign prostatic hyperplasia or BPH. This may cause problems with urination. Second, it may promote the growth of cancerous prostate cells. It is important to remember that prostate cancer is a common cancer for older men and is the second most common cause of cancer deaths in older men. Decreasing testosterone levels has been a method used to treat diseases related to both the benign and the cancerous groups of cells, but it is still unclear whether testosterone therapy for the older man places him at increased risk of developing prostate disease. For example, whether testosterone replacement therapy makes benign prostatic hyperplasia progress or makes previously unknown prostate or subclinical cancer spread. The vast majority of studies following PSA, prostate-specific antigen, made by both cancer cells at a higher rate and benign prostate cells, show that it does not increase significantly with testosterone therapy. All of the short-term studies have shown no negative effects on prostate size, maximum urination flow rates, and prostate symptom scores. It appears that testosterone replacement therapy has little short-term effect on the prostate. However, long-term data is as yet not available. Testosterone treatment for andropause. Treating low testosterone. There are numerous ways to deliver testosterone treatments to the body. These are oral medications, injections, transdermal patches and gels, for example through the skin, and implantable long-acting slow-release pellets. Oral medications. In the United States, this method of testosterone replacement is not available. The reason is that when taken orally, the testosterone travels through the digestive tract. Other medications taken orally, like those used for cholesterol, pass through the liver, where it concentrates at high levels and has been known to cause jaundice and liver inflammation. So, oral medications for testosterone replacement have not been approved by the FDA. Research is underway to explore safer ways of delivering testosterone orally. Testosterone injections. The two most common testosterone injections are testosterone cypionate and testosterone enanthate. These may be self-administered by the patient on a weekly basis. The advantages of the injections are that they are relatively inexpensive and can be administered independently from an office visit to see a doctor or nurse. The disadvantages are of significant medical concern. The testosterone in these injections is not bioidentical testosterone. With injections, the testosterone levels in a man's body peak and fall rather than remaining at a consistent level of distribution into the bloodstream. This is why, when prescribed, weekly injections are preferred. Injections tend to cause increased red blood cell concentration, hematocrit. When the concentration becomes too high, there is an increased risk of cardiovascular events, including heart attacks and strokes. Patients are often encouraged to donate blood regularly or have periodic blood draws to assess this condition. The testosterone in the injections may generate a negative effect on cholesterol and lipids. For these reasons, these injections are usually used as a secondary option where cost or convenience outweigh the risks. Testosterone patch, androderm. This has proven to be an effective way of delivering testosterone to the patient. However, many patients complain of irritation. Some patients find that they can relieve this by applying a small amount of cortisone cream before they place the patch on. Testosterone gels, androgel and testim. The most common method for testosterone replacement is use of the gels androgel and testim, which are both FDA approved. You would apply the gel on a daily basis, typically on the back, arms, and chest. It's more convenient to apply the gel at night before going to bed so it doesn't get on clothing or furniture. You would apply the gel, wait till it dries, and then put on a t-shirt. In the morning, you wash it off when you take the shower. Most patients can get good levels of testosterone replacement with the gels. Some men do not like the smell and do not like to have a daily regimen. It is also important that the medication not be transferred to the patient's partner or other members of the household, particularly children. Thus, many patients with small children or pregnant wives prefer not to use the gels. Testosterone pellets, Testopel. This has become a popular way of receiving testosterone replacement. Like the gels and patches, they are bioidentical testosterone, a generally preferred type of testosterone replacement. The pellets are placed underneath the skin once every 3 months. A local anesthetic is administered via injection, and then between 10 and 14 pellets are placed under the skin. A butterfly dressing is then applied. The main advantage of the pellets is that it is a very convenient method of receiving bioidentical testosterone replacement. The disadvantage of the pellets approach is that it is an involved procedure, though a very small one, which needs to be done every 3 months. There is also a small risk of bleeding and infection. This completes Section 2, Testosterone Therapy.